Thank you, Devin. Good morning, everybody. Good to see you this morning. Welcome to day 2. Today, we're going to start getting into the adult health and med-surg content portion of the review, which is the majority of what you're likely to encounter on the NCLEX. So this is a really, really important day for all of you today. Before we jump into we're going to start with skin and oncology. But before we jump into that, we wanted to revisit the mental health question at the end of the day yesterday, and wanted to just provide some clarification on the answer and the rationale. So as Dr. Gray had discussed with you all yesterday, the answer to the question was, in fact, gastrointestinal dysfunction. I'll just read through the question again here so that you all have the context. So the question is, the nurse is performing a follow-up teaching session with a client discharged 1 month ago. The client is taking fluoxetine. Which information would be important for the nurse to obtain during this client visit regarding the side and adverse effects of the medication? And then you had option 1 being cardiovascular symptoms, option 2, gastrointestinal dysfunctions, option 3, problems with mouth dryness, and option 4, problems with excessive sweating. So if we think about that medication or that question, it's asking about what information would be important for the nurse to obtain during the client visit. And this client was discharged a month ago, and they're now going to be taking fluoxetine. So they've started it and they've been on it for about a month. And so the answer is gastrointestinal dysfunction. And really what this question is getting at is, and this is what NCLEX will do with a lot of medication questions, is it's going to ask about the more frequent or more common side and adverse effects related to a medication. So for fluoxetine, the most common side and adverse effects include central nervous system and gastrointestinal system dysfunction. And common manifestations of fluoxetine, usually initially in that early part of taking the medication, include nausea, vomiting, cramping, and diarrhea. Usually those things will start to subside with continued use, and that's a really important teaching point for SSRIs like fluoxetine. I will say that this particular medication is not being used as frequently as an initial choice because of these side effects. And we know what these side effects can do with adherence, because people don't want to have to deal with being nauseous, vomiting, cramping, and having diarrhea. So, so that's an important teaching point with fluoxetine. And then as for the other symptoms, so cardiovascular symptoms, dry mouth, excessive sweating, and in particular with the cardiovascular symptoms, I think that I believe it was Nick that said that he wanted to choose that one, and that makes sense to me, but that is not really a common side adverse effect of fluoxetine. It may be for a number, and it will be for a number of other medications, and would be certainly the priority teaching point. But as Linda was saying yesterday, you'd really have to use your knowledge base to help you with that, knowing that that's not a common manifestation with fluoxetine use. Linda, was there anything else that you wanted to add to that?
No, and I think what Dr. Gray said yesterday and her rationale made sense. And it's just one of those drugs that you need to have the knowledge about. The cardiovascular, manifestations, I understand too, and as we talked yesterday, we could eliminate those that option 3 and 4, the dry mouth and the sweating, and get down to the 2. And using strategies, you tend to want to go to cardiovascular, but then it's when your knowledge base has to kick in, and you have to know specifically, what is characteristic of this particular drug. I know that.
And
Yeah, and
Go ahead.
I mean, some patients may have some heart palpitations, but that may be due more to anxiety than anything else, and it's not specifically related to the drug. So it's the knowledge that has to get you there. But again, we highly recommend that you go to the top 100 drugs in the back of the comp review book, and be sure that you're clear about and understand those, and look for specifics related to that drug, and nursing interventions and considerations related to that drug, and you should be all set. Also, this particular question is in the comp review book in the mental health medication chapter. So, if you want to read more about it there,
That's what I was gonna mention to them. It's question number 850 on page 989 and 990. And there is also a reference that if you wanted to go to that reference source, you could to read more about it. And it made me think of another strategy actually with this particular question, because when you think about dry mouth and excessive sweating, those are really kind of opposite effects. And so that's just something to think about. And that should just kind of put a light bulb off in your brain to say, like, okay, does it make sense that these things would occur with this particular medication classification? And so, a lot of the mental health medications or the psych meds cause what we call anticholinergic effects. And those are usually like the dry mouth, like the slowing down of systems, and dry mouth, dry skin, things like that. And so, but with this particular one, it isn't. So again, there's that knowledge base that needs to come in. But I think that's what those 2 distractors are trying to get at, is the anticholinergic effect, testing your knowledge on that. And is that a concern for fluoxetine? But then you think about excessive sweating too, that's really not a very common side effect for many medications at all. And excessive sweating, I would be thinking about other physical conditions versus a side effect of a medication. So just a couple other points and maybe ways that you can think through a question like that, where you're really not sure of the answer and where your knowledge base isn't helping you. But I think it's a really important discussion of, how we need to look at a question, not just say to yourself, okay, I don't know the answer to this, so I'm just going to guess. That's probably the worst thing that you can do when you're taking NCLEX, because first of all, you're missing that opportunity to get that question right. And it's also going to start building test taking anxiety as you continue through the exam, taking that approach. So I think this example demonstrates this well for us. And please, please, please just slow down and really break down the question and the options into parts so that you can really think about each thing, and apply strategies where they make sense to do that. So any questions about that part before we start with the content for the day?
Yeah, and another point about specifics related to medications and drugs, and you're going to see that when we talk about oncology and chemotherapy. And we know that with chemotherapy, with just about almost all of the meds, patients lose their hair. But when you're asked a question about a specific drug that's a chemo drug, that's probably not going to be your answer, because that's a common side effect. And you'll see that with some of the meds we talk about today, such as vincristine. If one of the options was hair loss, you don't want to pick that. You'd want to pick the neuro option because it causes peripheral neuritis. So it's that kind of knowledge base you have to have with certain drugs and hook up certain special things about that drug that will be important for you. Okay.
Thank you, Linda. I think that's good. And I just wanted to mention really quickly that we do have a change to our agenda today because Miss Lisa has to go earlier in the day. So after Linda's section here, we're going to then move to respiratory and cardiac this morning, and then I'll do neuro and musculoskeletal instead in the afternoon.
Oh, okay. Thank you. It's good to know that. So I'll be sure I'll be on time for Lisa. Stay on track here. Okay, so if there aren't any other questions, I guess we'll get started, and we're going to start by talking about integumentary and the skin. And it's not likely that you're going to see a lot of specific questions on skin. You're probably going to see things on pressure injuries, of that sort of thing, and risk conditions and preventing and assessment for high-risk patients. But other than that, there are some concepts that you want to keep in mind when you do have a question on a specific skin disorder or health problem. And those concepts that you really want to keep in mind, that you want to jump in mind when you see a question on a skin problem, is you need to remember that your skin is the first line of defense against infection. So infection needs to pop into your mind. It's a major concern. So again, whenever you get a question on skin, think about infection. The other concept that you want to think about with skin disorders is body image. So keep those two things in mind. Infection and body image are real concerns with skin. Now, you'll probably see, you might see even some questions that relate to pediatric skin disorders. And what you want to keep in mind is that there are a few skin problems that are more specific to children, such as perhaps impetigo. But as far as treatment for skin disorders for children and adults, the treatment is the same, but you just need to remember with all disorders in pediatrics that the child is smaller. So treatment may be a little bit different in terms of how much treatment they're going to provide to that client or patient. So just use the adult concepts when you're applying to the child, and just keep in mind the child is smaller. So remember infection, remember body image, remember with the child, they're smaller than adults, so their treatment's going to be less than you would provide for an adult. Some of the concepts or the content areas that you might see on the exam may have to do with herpes and shingles. Okay, shingles might be something that you'll see a question on, and so that's really important. Remember, we have shingle vaccines for that older adult client, and that's a very painful disorder. It's a viral infection, and we'll see a picture, I think, of that this morning. MRSA is another one, so be sure you're clear about MRSA. Cellulitis, okay, cellulitis is another content area. And, one of our concerns, and I mentioned infection, but a big concern with some of these disorders, and especially with cellulitis, is the risk for sepsis. So keep that in mind, okay? You might see questions on community issues, the homeless population, what they're at risk for with skin disorders, just frostbite. So that's important to keep in mind and review. And then skin cancer, that's a biggie. Okay, so your skin cancer is a very important one. We'll talk about that this morning. Okay, so we should probably have a few questions next on the next slide. Okay, there's our integumentary system. Okay, so here we go. The nurse provides instructions to the mother of a child with atopic dermatitis eczema about applying topical cortisone cream to the affected skin sites. Which statement by the mother indicates an understanding of the use of this medication? 1, I should never rub the medication into the skin. 2, I should apply the cream everywhere except on the face. 3, I need to apply the cream in a thick layer and allow it to absorb. And 4, I should wash the sites gently before applying the medication. Okay, so we can see what you do with that. Are we timing the responses or Angela?
It's up to you, Dr. Silvestri, and what you want to do. You can tell me when to call it.
Oh, okay. All right.
I usually just do roughly, 10, 15 seconds. I kind of just watch them come in, and when I get to about 40 is usually when I do it.
Okay, because I can't see them coming in. That's why I was wondering.
Oh, okay. It should be, does the poll come up on your screen?
I see the questions. I see a little poll thing up in the left-hand corner.
So like where it says one question, 40 out of 53, 75%. Do you see
No,
that?
I don't see anything like that.
Okay, well then I would just say give them roughly 10 to 15 seconds and then,
Okay.
and you know what, Devin, can I just make a suggestion?
Sure.
I from a presenter or like from an audience perspective, it's kind of like brain numbing to hear open poll, end poll, open poll, end poll. Is there any way you can just like open it, and when you see about 40-ish responses, just close it so that the presenter doesn't have to keep saying that? I know it wasn't you or anything, but I was just listening yesterday and I'm like, oh, I'd rather not hear that. So if there's a way to just do that, I think that would be really good.
Yeah, works for me.
Thank you,
Okay,
Devin.
great. Okay.
Excuse me. Well, with that being said,
Yeah. Okay, so we have 49% of you who selected option 4, which is definitely the correct answer. And if you keep infection in mind on the concepts that I emphasized, I should wash the sites gently. Gently is a good word. That's a good word in an option. And you might consider selecting something if you're trying to make an educated guess. So I should wash the sites gently before applying the medication. And so that is your correct answer. Option 1, I should never rub the medication into the skin. You don't want to go with such closed-ended words, okay? And you do want to gently rub the medication on the skin. I should apply the cream everywhere except on the face. Well, what if the eczema is on the face? Okay, so that would be wrong. And I need to apply the cream in a thick layer. Thick's not always a great word, okay? So you probably want to eliminate that option too. So hopefully that helps you. Okay, so the next slide. Let me close. Okay, so here's a picture of really bad eczema on a patient's a little kid's face here. So, you can see it's a really bad inflammatory process, superficial. What our goals are with eczema is it's very itchy. So we want to relieve that pruritus, the pruritus, that we don't want that child itching and scratching because they're just going to break it open and then we're at our risk for infection again. So we lubricate the skin, we try to reduce the inflammation and definitely want to prevent any of those secondary infections. So we can see it's red, it's scaly. As I said, it's itching, it'll weep and it'll ooze. So our antihistamines, our topical corticosteroids are important, sometimes baths and lubricants or some soaks. And of course, we want to avoid any irritants. And so one way we can minimize them breaking their skin, because they'll take their little fingers and their little nails and scratch, we can put gloves on their hands, maybe white gloves or something like that. So just a few tips on that. Okay, so our next question we have a child who has lesions around the mouth and nose is diagnosed with mild impetigo. After reinforcing instructions to the mother, the nurse determines further teaching is needed if the mother makes which statement. Impetigo is extremely contagious. My child will need to take an antibiotic. The crusts on the lesions should be soaked and carefully removed. The skin lesions should be washed gently 3 times daily with a warm, soapy washcloth. Okay, so take about 10 to 15 seconds. Okay, so what you want to look at in this question is further teaching is needed. So the answer here is 2, because oral antibiotics are not prescribed for this. They may need topical antibiotics, but they don't need to take an antibiotic. So is impetigo extremely contagious? Yes, it is very contagious. Okay. The crusts on the lesions should be soaked and carefully removed. Yes. And the skin lesions should be washed gently 3 times daily. Usually warm compresses 2 to 3 times a day will soften them, and then some soap and water will help for, to remove and promote some of that healing. So I think we have a picture of impetigo next, and okay. So this is normally caused by a beta hemolytic strep, and usually we will see this in children in those hot and humid months. And an insect bite or any break in the skin can cause this, and then we'll see something like this, and they form into these kind of honey-colored crusts. Okay, so we'll look at the next question. Okay, so let's see what you do with this. The client who has open draining lesions on the legs from Kaposi sarcoma needs to be bathed and have bed linens changed. What personal protective equipment should the nurse wear to perform these care activities? So we have gloves only, gown and gloves and a mask, gown, gloves, and a mask. Now, when you get these questions on NCLEX, really focus on the data in the question and what they're asking you. Okay? So let's see what you do with this. Okay, great work. The answer here is 2, gown and gloves. And if you look at this question, you want to be cautious with these kinds of questions when they're asking you about personal protective equipment, because since COVID, we tend to want to select answers that always have a mask in the response or in the option. But that's not the case here. Granted, if the agency is requiring masks, yes, we're going to wear them for all patient care, for any patient. But this is asking you about Kaposi sarcoma, and that the client's being bathed and having the bed linens changed. So what you need to think about is that type of contact precaution, and answer 2 is the correct answer. Remember that Kaposi sarcoma, we see this in individuals with compromised immune systems. They're very slow growing tumors, and they're usually raised sort of oblong, purplish, reddish brown lesions. And they not only are seen on the skin, but they can occur internally and affect organs inside of the body. So that's what to remember about that. So again, focus on type of precautions that they're asking you about in the question. Okay,
Can I ask a question?
of course.
Oh.
Do you want to go back to that question?
Yeah,
Bevan?
is that okay? So with that, the only reason I chose with the mask is because of, I think of changing bed linen and like stuff like, I guess, like scoffing off, like just from them laying in the bed, and just me personally breathing that in just sounds disgusting.
It
So,
is. It is.
and I'm not
And
saying that, and I'm not saying that in a mean, that came out wrong, but what I'm meaning is like, just, I would want to protect myself as much as possible with that.
Okay. And you know, I'm with you on that. I understand and I agree. And I would probably wear a mask too. But what the point of the question here is, Kaposi sarcoma, how is it spread?
Infectious. Okay.
And yeah, and we're talking about a contact precaution. And according to the CDC, for contact precautions, we would need, based on what this question is asking, bed linens changed and bathing the client. So your answer would be 2. Okay, so just be really careful about what you want to do, what you think is best for you, and what, you know, CDC will say about these types of precautions. Okay, but great point.
Linda,
Yes.
Linda, thank you for that. We did have another question. It was on a question prior to the one previous to this. Yes, so the question was, answers 3 and 4 seemed very similar. Would a test taking strategy be applicable?
Yes, if you have 2 options that are similar, then probably neither one of them are correct. Okay, so you could eliminate 3 and 4 in this particular situation. Okay, so yeah, that is a good strategy. Whoever brought that point up, that's great. Okay, so here's our next question. The admitting nurse has just notified the nursing unit that a client diagnosed with herpes zoster is being admitted. The nurse understands that a staff member who never had which disease should not be assigned to the client: mumps, pertussis, chickenpox, or German measles. Oh, great work. 91% of you selected chickenpox, and that is the correct answer. So what we want to remember about herpes zoster is that is shingles, okay? And it's actually the reactivation of the chickenpox virus. So the other options they're contagious, but these other disorders, mumps, pertussis, German measles, are contagious, but they're not related to herpes zoster. Okay, I think that we have a picture of that on the next slide. Here we go. Here's a picture of that. And you can see the eruptions that are occurring, and they usually occur like in a distribution, a segmental distribution on the skin along a nerve. Okay, and that is why the nerve is infected, and that is why this is so painful for people. There are antiviral medications that can be given to help with this, but you know, the pain is really very bad from what patients will tell us. And as I mentioned, there is a vaccination for people who are over 50 years of age. So, you know, you should highly encourage patients to get that. Okay, on our next slide. Here are some common sites for pressure ulcers. We'll call them pressure injuries now, resulting from, you know, the skin shearing and the friction. So what you want to keep in mind is any area where friction will be caused on your client who is in bed or in a chair or whatever, is a risk area for developing a pressure injury. So, really keep that in mind. And then on the next slide, here we have the four stages of the pressure injuries. And again, we're calling them injuries rather than ulcers. And your role is really prevention, and assessment is a key factor. And we have a lot of tools out there for us as nurses that we use when a client is admitted, to an agency or whatever, for assessment of pressure injuries and also for their risk for falls. So we need to use those tools. We need to identify the clients who are at risk, and we need to immediately put measures into place to prevent any of these awful pressure injuries. Now, if you go to page 516 in your book, comp review book, you'll see the additional pictures of other stages, suspected deep tissue injuries, and those that are unstageable, which are really full thickness injuries. So you'll see those pictures also. And the questions that you're going to have on NCLEX related to pressure injuries, they're going to be more on assessment and prevention rather than on dressing types. So don't worry about all the dressing types that you see in the comp review book. You don't need to be memorizing all of those. Just remember, prevention and assessment is what is really key here. Okay. All right, next. All right, here's a question on burns. The client has sustained circumferential burns to the right arm. The nurse should position the extremity in which manner? Straight without elevation, elevated above heart level, flat but flexed at the elbow, lowered in a dependent position. Okay, so our answer here is option 2, elevated above heart level. Okay, so now you want to keep a couple of concepts in mind. Whenever you see circumferential burns, you always think of constriction. And you may on NCLEX see a question about circumferential burns to the thorax. And if you saw that, you would think about airway problems and breathing problems, because what happens when in a burn injury is, if you think about the inflammatory process, we're going to have edema and swelling. All of the fluids are going to go right to that injured place. And so we're going to expect a lot of edema and swelling, and that is really going to constrict. Think about gravity, the concepts of gravity. Okay, so this is a circumferential burn to the right arm. We want to elevate that so we don't have any problems with circulation to that radial pulse, that peripheral extremity of that. And I think we might end up having a picture of that soon. But so you might have questions on this because we've been concerned about edema and concerned about circulatory status. So there we are with the ABCs. If a burn client came into the emergency department, our initial primary concern is airway patency. So that would be number 1. And giving oxygen to that client, checking their vital signs would be really important. And IV fluids are critical. IV fluid replacement is extremely important. And there are several resuscitation formulas that the ED physician will use to determine how fast the rate of the fluid should be going. And so those are key things. We also would elevate extremities as long as there are no fractures in any of the extremities. You want to keep that person warm, and you want to keep them NPO, okay? Pain medication is critical. but it would need to be given by IV. We need to avoid any intramuscular, subcutaneous, or any oral pain medications, because the absorption factors in a burn injury, I mean, the absorption is just so unreliable, especially when hypovolemia and those large fluid shifts occur as in a burn injury. So any pain medication definitely would need to be given by IV. Okay, let's see what we have here. A client with partial and full thickness burns has received fluid volume resuscitation. The nurse uses which data as the best indicator that this therapy has been successful and circulatory status is stable? Okay, so we have urine output greater than 30 mLs an hour, level of consciousness intact, systolic blood pressure reduced by only 10 mmHg, and peripheral pulse volume only slightly diminished. Excellent. Option 1 is the correct answer. 89% of you selected that. Okay, as far as option 2, level of consciousness intact, well, our level of consciousness in this person who has probably received a lot of pain medication, it's not really that reliable. Okay, whereas your urine output is really the most reliable and the most sensitive, non-invasive assessment parameter for cardiac output and tissue perfusion. So urine output, and not only for burns, but for other disorders also in which fluid resuscitation is being done. So try to keep that in mind. And no one selected option 3, that's great. And there were a few people who did select option 4, peripheral pulse volume only slightly diminished. Well, we don't really want it diminished at all. And so try to keep that in mind. And that's why option 4 is probably incorrect, if you look at it from that point of view. Okay, on the next slide, we have a picture. Oh, we have a question. Okay, let's do that, and then we'll look at a picture. A client with a full thickness circumferential burn of the lower leg has undergone escharotomy. The nurse evaluates if the client is obtaining the expected benefit of the surgery, if which data is noted: return of distal pulses, decreased edema at the site, formation of granulation tissue, or small amounts of bleeding at the site. Okay, so remember we said about circumferential burn. Our concern when we see that word circumferential burn of an extremity or a thorax or whatever, we think about the edema that occurs with the injury, and we think about constriction, okay? So our answer here is option 1. Because of the return of the distal pulse, we know that circulation has been is good, it's great. So most of you selected option 3, formulation of granulation tissue. But what you need to remember also is you need to know and use some knowledge about what an escharotomy is to help you answer such a question at this. It is not directly going to decrease the edema, okay? And we may have some bleeding at the site, but from the escharotomy, but that is not an expected benefit. So we have to focus on circumferential burn, okay? Think about constriction. We're worried about a perfusion to that extremity and the benefit. You're evaluating the expected benefit, and that should help get you to option 1. There's a picture on the next slide of an escharotomy. And let's take a look at that. And that might help you with questions. So you would see, this tight circumferential eschar that occurs that restricts the outward swelling as the edema forms from the injury. And then the edema compresses, pushes on all those blood vessels, which stops the blood flow to that extremity, as you can see, to the hand. And when they do an escharotomy, it's an incision that allows outward swelling of the edematous tissues. So although that was a really good distractor about the edema, reducing edema, that is not our expected benefit. Our expected benefit is that there would be adequate blood flow to the vessels distal to that injury. And so maybe this will help you if you should have questions on escharotomy on the exam. But think about that circumferential. And when you see that, think about constriction, and that might help you because you're worried about blood flow to that extremity. Okay, let's see. All right, a few drug questions. So we have tretinoin is prescribed for a client with acne. The client calls the healthcare provider's office and tells the nurse that the skin has become very red and is beginning to peel. The nurse should provide which information to the client? To discontinue the medication, to notify the healthcare provider, to come to the clinic immediately, that this is a normal occurrence with the use of this medication. Okay, so most of you selected 4, which is definitely the correct answer. This drug is an exfoliator, causes like cell turnover, and they'll end up having a flaky, dry crust. And so option 4 is definitely your correct answer here. Now, this is one of those questions, like the question we discussed this morning. First off, you need to know the specifics. And what we're doing through these this review course is showing you drugs that have certain specific things you want to know about them. So you want to know that this drug does cause that, it's a normal occurrence, so that you can tell the patient and teach the patient what to expect. Now, to discontinue the med, you don't want to select that option because the nurse would never discontinue a med. That's not within her or his role. Now, you may say to a patient, hold off on the med until we get back to you, and I'll discuss this with your healthcare provider. But you would not discontinue the med. And because it's a normal occurrence, we don't need to notify the healthcare provider. Plus, in many cases, there's always something you can do as a nurse before calling the healthcare provider. So you want to keep that in mind and help you to eliminate option 2. Then to come to the clinic immediately is kind of an alarming type of response. So it's probably a type of response you want to stay away from. Okay, so I think on the next slide, we have a picture of acne. This is pretty bad. And we know that that's a chronic skin disorder, requires really active treatment to control it until it resolves. And the person will have these red pustules and papules and nodules. And it's, okay, so here we go with the possibility of infection if they break open, but then the body image is a true concern here. Okay. All righty. Lindane is prescribed for the treatment of scabies. Okay, so here's another disorder that you probably want to write down and read about in the comp review book. The nurse would question the prescription if the medication were prescribed for which client. A 23-year-old client who is healthy, a 6-year-old child with any diagnosis, a 52-year-old male with hypertension, a 42-year-old female with gallbladder disease. Okay, so looks like you had a little bit of trouble with this one. All right, so this is another drug that we selected to present to you today because there's something very specific about this drug that we want you to remember. Okay, now scabies, it's a parasitic skin disorder. Our answer here, let me tell you, is option 2. Okay, we would not use this topical medication in any child younger than 2 because there is a risk of neurotoxicity and seizures. Okay, so this is really important. I mean, it's a risk for any patient, but what's really important to remember about this is this would not be prescribed for a child younger than 2. So write that down and keep that in your mind. You'll, you might see questions on scabies. You might see questions on topical treatments. If you do, you're likely to see this drug mentioned. They probably aren't going to ask you some real specifics about how to use the topical treatment. Usually it's put on and the person would take a bath, put the Lindane on or whatever is prescribed and leave it on for 8 to 12 hours and then shower. The important thing to remember is that this is contagious. It's transmitted by personal contact with that infected person. And so all contacts of the person who has scabies need to be treated all at the same time. And I think that that would be the concept that they would question you on if you do get a question on scabies. Okay, so are there any questions about anything with what we discussed? And I think those are the key points that you need to, focus on, and the disorders that I mentioned at the beginning. And again, really keep in mind infection and body image, okay, with any of these.
Linda, we had one question come through in the chat. And was it a child younger than 2 or any age for a child? Because the answer was a 6-year-old. I think.
Okay, I see what you're saying. Question. Yeah, that's a really good point, and thank you for bringing that up. And I think we probably need to change this question. It should say a 2-year-old with any diagnosis. Okay, the literature for this drug will say not used in children younger than 2. So that's the concept you want to keep in mind. But if you had, go ahead.
I was just going to say that that's a pretty consistent guideline when it comes to medications for children, is that it's really conservative use with multiple medications, in particular for children that are younger than 2 years of age. And so once they hit 2, it becomes that there aren't so many guidelines that say that they can't have medications. That's kind of that magic number for a number of medications, lots and lots of over-the-counter types of medications. And when a child gets sick and they're less than 2 years of age, you're really limited in what you can give them to manage the symptoms a lot of the time. So I think that's just a good kind of general guideline to keep in mind.
Okay, and thank you. No, it doesn't change. The answer still would be option 2, because a 23-year-old who's healthy, there's no reason why they can't use this. Same with a 52 and a 42-year-old. So it's really the child that's the issue here for the answer to this question. And as Angela described, we're really limited with children and with treatments. But we may want to make a note to revise this question. So whoever brought that point up about the 6-year-old, thank you very much. And but hook up Lindane with neurotoxicity and seizures in children, specifically younger than 2 years of age, and would not be prescribed. So, and cautiously, would be prescribed very cautiously with any child, even a 6-year-old or a 5-year-old. So that's the point of this question. Okay.
So, and I'll just address Nick's question in the
Sure.
chat. Nick, you can consider it a typo on our end. And so you could just kind of pretend it says 2-year-old. That was our intent there. And Linda, I'll just update that right now so we don't forget. And thank you for catching that, you guys. Appreciate it.
You're welcome, Nick. Great questions. You're helping us to improve our course here. So thank you. Okay, so we'll move on. And we're going to talk about hematology and oncology, and we're going to start with a few questions. And then I want to give you some key concepts to remember for any question that may have to do with cancer. So let's look at this. Oral iron is prescribed for a child with iron deficiency anemia. The nurse explains to the mother that the iron should be administered in which way? With a juice high in vitamin C, with beef or other red meat, with a source of glucose, with water only. Oh, excellent. 97% of you selected option 1. That's great. There's a few of you that did select option 4. No one selected option 2 or option 3. So that's great. So the thing you want to remember about iron is that it is best if we give it between meals and give it with something that is very high in vitamin C. A question similar to this was actually on the NCLEX, and the answer to the question was tomato juice. Okay, very high in ascorbic acid, very high in vitamin C. So that's something to remember. And the other thing, when you see oral iron and you think about liquid iron, if they're asking you about that, because liquid iron can stain the teeth. So that's something really important to keep in mind. And if a liquid iron is prescribed for a child or any person, that it should be taken through a straw, and then the teeth should be brushed immediately after, so we can avoid that teeth staining issue with it. Okay, next question. The nurse provides instructions to the mother of an 8-year-old child with hemophilia about safety with play and activities. So which statement by the mother indicates an understanding of safety measures? My child can continue with the swim team at school. Hockey is a safe sport as long as it is field hockey. Soccer is a safe sport because the ball that is used is soft. My child can play any sport as long as he does not overexert himself. Oh, excellent. Okay. I think you know your concepts related to hemophilia. Okay, so our biggest concern with hemophilia is bleeding. So that's our true concern. And the sport here that is really going to be least harmful is swimming. I mean, hockey can cause an injury that can cause bleeding, same with soccer. And playing any sport at all, no way. So you did excellent with that. So remember, with hemophilia, what we do for treatment is replace the missing clotting factor. You know, if bleeding has occurred and they tend to bruise and bleed very easily, we want to control that bleeding, especially if it's in a joint, by ice and immobilization and elevation. Questions on NCLEX relating to hemophilia are going to probably focus on safety measures. And so this is an example. Swimming is like one of the probably the best exercise for a child with hemophilia. So ice, elevation, immobilization, if there's bleeding, especially into a joint, pain relief. And it really depends on the bleeding and on the cause of the bleeding. So remember those safety measures, and I think you got that one down pat. Okay. On our next slide, we have a question on osteogenic sarcoma of the leg. So the nurse is reviewing the history and physical of a child with osteogenic sarcoma of the leg, and the nurse determines that which client finding is unexpected. Okay, so you want to focus on that unexpected. Okay, I got to move something here because I can't read the options. Here we go. Okay, 1, limping in the affected limb, presence of a palpable mass, reports of pain at the tumor site, or full range of motion of the affected limb. Okay, so reading this question carefully, the nurse determines that which client finding is unexpected. So with osteogenic sarcoma of the leg, they would not have full range of motion of the affected limb. So for this question, the correct answer is option 4. They are going to have limping, okay? There will be the presence of a palpable mass, and they are going to have pain. This is osteogenic sarcoma is the most common bone cancer in children. And a lot of times once this is diagnosed, parents feel really guilty because a lot of the times the symptoms are attributed to an extremity injury or normal growing pains even. So they have that localized pain, they have that mass, they have the limping if the limb is in fact, in the limb that is affected, and they would have limited range of motion in that extremity. Our concern with this is fracture, okay, and surgical resection or amputation of the limb, will need to be done. And so we're back to body image, and it's very difficult with children because many times they just don't understand. So amputation, and here's a picture of osteogenic sarcoma in one of the joints. Looks like it might be the knee area or somewhere. So it's pretty bad. Okay. And then on our next slide, we have a question on Wilms tumor. Let's see what you can remember about this. The nurse is developing a plan of care for a child diagnosed with Wilms tumor and should include which intervention in the plan of care? Monitor the temperature for hypothermia, monitor the blood pressure for hypotension, inspect the urine for hematuria at each voiding, palpate the abdomen for an increase in tumor size every 8 hours.
Linda just wanted to mention while they're answering that question, I just checked with Lisa. She is fine to start a little bit closer to 10 a.m. Just because I'm just looking at our time. So you can just feel free to continue because she can be flexible.
Oh, okay, that sounds good. Yeah, we took some time as we started off talking about the drugs. So I have 9:02
no
right
worries.
now. Okay, great. Okay.
Doing pretty good. I just thought I'd give you a little extra time, and that way they can still have their break too.
All right, that sounds great. All right, so the answer here, which intervention do we want to include in the plan of care? Well, the answer here is 3. And what we want to remember is that Wilms tumor, this is really important to remember. And if you're going to be asked about oncology in the child, Wilms tumor might be one, leukemia would be another, and osteogenic sarcoma would be another. And the thing that you want to hook up with Wilms tumor is that it's an intra-abdominal and kidney tumor. And that's how you would get to option 3 as your answer. This child will have swelling, a mass in the abdomen, and you definitely avoid any palpation, okay? and use caution even when you're caring for that child, when you're turning the child, moving the child, because we need to keep that tumor intact. If that tumor ruptures, then the cancer cells are going to spread through the entire abdomen into the lymph nodes and into the bloodstream, and it will metastasize. So that's the key point with Wilms tumor. Fever is a manifestation of this Wilms tumor. So you wouldn't monitor the temperature for hypothermia, you'd monitor it actually for hyperthermia. And it's an intra-abdominal and renal tumor. So you would monitor the blood pressure for hypertension. Hypotension does not occur. So your answer here is 3, and usually surgery and chemo combined is done to treat this tumor in the child. Okay. All righty, and here is a picture of a tumor, a Wilms tumor that was removed. So that looks pretty awful. All right. Okay, so here's a picture of skin cancer. So skin cancer is something that you would probably see on the exam because it's very common, and we're always worried about sun and sun tanning booths, etc. Here's your squamous cell, your basal cell, which is the least invasive, and then the melanoma, which is most invasive. So your key, if you have any question on skin cancer, is prevention and teaching the client about sun, staying out of the sun between the hours of 10 and 4 during the day, covering the skin, etc. Because the skin cancer, if there's a melanoma, it can be deadly. And so we certainly don't want that. Before we go to the next slide, let's just talk about a few things with cancer and cancer patients and questions that you may have on your exam about cancer. Now, we know there's lots of different types of cancer. And it can be overwhelming when you think about NCLEX and what are they going to ask me. But let's just talk about some points that you want to keep in mind that are going to be very helpful for you to answer a question on cancer. When you get a question, always read it. Look at where the cancer is located, because that will be a key to helping you answer that correctly. The first thing you want to remember is pain management, okay? Pain is key. So if you have a question on cancer, or you're caring for a patient with cancer, you always want to ask that person, what is your pain level? What is your pain like? Do you have any pain? Pain is always what the patient says, okay? And in the client with cancer, we are not concerned about addiction, okay? So we are not concerned about that in a client with cancer. Treatment generally is going to be chemo, radiation, surgery, radiation that's either internal or external. There's radiotherapy, there's ablation therapy, there's immunotherapy. We have so many treatments for cancer these days that it can be very hopeful for any patient who's been diagnosed with cancer. Surgery, we hope to cure, okay? But there are a lot of options and a lot of treatments. There's on page, let's see, 534 to 535 is about radiation implant care. And you definitely want to read those boxes about how to care for patients with a radiation implant. So be sure to focus on that. The other concern that we have with chemo that you want to keep in mind is we're monitoring lab values. Okay, so lab values are critical. We're looking at the white blood cells, the neutrophils, the platelets. Remember, when platelets drop, the client is at risk for bleeding. And so bleeding interventions or precautions need to be put in place. Your normal platelet count, 150,000 to 400,000, so you want to keep that in mind, okay? Your normal white blood cell count is 5,000 to 10,000. You want to keep that in mind. When that white count drops, patients at risk for infection. So remember infection, remember bleeding, platelets and white blood cell counts, and the neutrophil count. Those are our big concerns. Another concern with cancer, when you see a question you want to keep in mind, is the client psychosocial points, the client's acceptance of the diagnosis. Think about the client's fear, address that. Lifestyle changes are huge. The impact that it has on someone's daily life is really impactful. So those are some points to keep in mind. Again, as I mentioned, there's a lot of new advances in treatments. So again, you get a question on cancer, focus on the area of where the cancer is that they're addressing in the question. Again, pain is your primary concern. Nutrition is a real concern. So remember nutrition. So pain jumps into your head, nutrition jumps into your head. Weighing that client is really important. Monitoring for weight loss is critical. Okay. If you have a question on a transplant patient, post-transplantation, remember that that client is without any natural immunity until those donor cells begin to proliferate and engraft. So that usually takes about 2 to 5 weeks. So we need to be really careful with those post-transplantation patients. Watch their blood laboratory values very carefully. White blood cells, red blood cells, platelets, neutrophils. If a question talks about laryngeal cancer or lung cancer, the thing that needs to pop into your head right away is breathing and airway, okay? And look for options that have to do with that. If a question talks about esophageal, throat, gastric cancer, think about swallowing, okay? Swallowing issues, which could lead to aspiration if they can't swallow well. Definitely nutrition with all patients, but most specifically with esophageal and throat and gastric because they're having trouble eating. And also with your gastric cancer, think about your B12 deficiency. Okay, and that person may require B12 monthly for the remainder of their life. If the question talks about a brain tumor, what you want to jump into your head is headaches, increased intracranial pressure, okay, sight problems, any neurological effects in the body. Okay, so think about that with brain tumors. If the question is about a blood cancer such as leukemia, okay, infection and bleeding are a huge concern. Okay, so think about that. Multiple myeloma, okay, which is a malignancy of the plasma cells in the bone. Okay, if you can remember that about multiple myeloma, plasma cells in the bone are affected, then we would think about the risk for pathological fractures, and that's what you want to jump into your head if you see a question on multiple myeloma. If it's on, if you see a question on testicular cancer, remember self-examination is critically important, a monthly self-examination, which we'll see, I think, some slides on that. We worry about, concern is sterility. Another concern is body image, and be real familiar with the signs of testicular cancer, which I think we'll be going over. Any cancer of the reproductive system, such as the cervical cancer, uterine cancer, ovarian cancer, think about reproductive ability, keep that in mind. Some of these cancers, such as ovarian cancer, is unfortunately usually diagnosed very late in the disease process. And so, that's a tough one to treat. So keep that in mind. Breast cancer, self-assessment is key with breast cancer. And we're going to see a couple questions on that too. Your pancreas cancer is usually a very poor prognosis. And the problem with that is because, like ovarian, A patient, by the time the patient shows some symptoms of the pancreas cancer, the jaundice, the discomfort, problems with eating, etc., it's very late in the stage of the cancer. And so prognosis can be extremely poor. One of the things we want to think about, we'll think about the pancreas and think about the organ and what that organ does. Patients with pancreas cancer will end up with probably diabetes, okay, because those cells are damaged from the cancer progressing. If it talks about cancer of the bowel, then our concern is bowel elimination. And remember that colonoscopies are really prevention and an excellent prevention and screening method, and that needs to be encouraged. A lot of people don't want to have them, but that is really important in terms of teaching for prevention. And, prevention is really key with all of this cancer. So keep those things in mind when you're answering questions. And then the bladder cancer, our concern would be urinary elimination. Bladder cancer, usually the initial sign is painless hematuria. So that person will urinate blood and doesn't hurt. They might do it a couple of times and then they don't bleed anymore. But they really need to have that, checked, because that's how bladder cancer, bladder tumor acts. The person will bleed blood, will urinate blood, and then the cancer is there, but the hematuria goes away so quickly as it comes that people tend to want to ignore it. So those are some really key points about cancer that you want to keep in mind if you have questions on cancer. Let that stuff jump into your mind. Really focus on the cancer that they're asking you about in the question. Okay, and there are some drugs that we really want you to focus on that are important. So I think we have a question coming up on a drug possibly for the next slide. Okay, the client with leukemia, okay, who is receiving busulfan is also started on allopurinol. The nurse explains to the client that allopurinol will prevent which potential problem that could be caused by the busulfan: arthritis, diarrhea, stomatitis, or hyperuricemia. Okay, so this is excellent. 73% of you selected option 4, which is the correct answer. Some of you selected some of the other options too, but well, let me just tell you that busulfan is usually used to treat leukemia, and it also is used to prepare the body for a stem cell transplant. But for any chemotherapy, most times patients are also started on allopurinol. And if you knew that allopurinol was also used for gout, that would help get you to option 4 as your answer. But let me tell you why allopurinol is prescribed with chemotherapy drugs. When chemotherapy is given, what ends up happening is that chemotherapy kills cancer cells, also normal cells, but it kills the cells. And when the cells are killed, they burst. And what is released into the bloodstream is uric acid. Okay, so we don't want that person to have another problem on top of the problems they already have and end up with crystals floating around their bloodstream, ending up in their kidneys, damaging their kidneys, and giving them gout and pain, etc. So allopurinol is given to prevent hyperuricemia and further problems with the person. So you see a question on chemo, and we see the person with leukemia. who's receiving busulfan and you say, I have no idea what busulfan is. Well, look it up. Leukemia is a cancer. So busulfan is most likely a chemotherapy agent. And that's how you can help yourself with these types of questions. And then moving to the allopurinol, if you remember that concept that I just explained to you about the release of the uric acid when the cancer cells are destroyed, that will help get you to the right answer. So hopefully that helps. Okay, next question. A nurse is providing medication instructions about cyclophosphamide with a client who has breast cancer. What instructions should the nurse include in the discussion? Now, if you didn't know cyclophosphamide and you see the person has breast cancer, you would think chemotherapy. Okay, that's how you would think about this question. So take the dose with food, increase fluid intake to 2,000 to 3,000 mLs, decrease sodium intake while taking the medication, increase potassium intake while taking the medication. Okay, most of you selected answer 2, and that is definitely the correct answer. What I'd like you to hook up in your mind with cyclophosphamide is that it can really cause problems, and specific to this drug is hemorrhagic cystitis. And so if you think of cystitis, and what we tell patients to do is increase their fluid intake. So that is why option 2 is correct. So hook up cyclophosphamide with hemorrhagic cystitis, and that will help you answer the questions. Options 1, 3, and 4, it does not have to be taken with food, and they don't need to decrease sodium intake or increase potassium intake. That has nothing to do with the med. So that's just one of those meds that we want you to know about. Okay, on the next slide, I think we have another drug. A client with non-Hodgkin's lymphoma is receiving daunorubicin. Which sign indicates to the nurse that the client may be experiencing a toxic effect of the med? Fever, diarrhea, dyspnea, nausea, and vomiting. So focus on the word toxic, okay? And something specific about this med we will be talking about. Okay, excellent. Option 3 is the correct answer. Okay, so this is something we want you to remember about this drug, a toxic effect. So if you see toxic, first of all, look at your options, and ABCs would bring you to option 3. Second, remember daunorubicin, okay, and think about ruby red cardiotoxicity. Okay, so that's what I would always remember about this drug to help me get to the right answer. So your respiratory cardiac symptoms would be the answer to a question such as this. Also, if you look at nausea and vomiting and the diarrhea in option 2, they're similar, relating to the GI tract. So best to just get rid of those. And that will help you hopefully to answer a question related to that. Okay, next, let's see. Okay. A client with laryngeal cancer is receiving bleomycin intravenously. This is another drug we want you to pay attention to because of something specific about it. The nurse anticipates that which diagnostic study will be prescribed for the client: electrocardiogram, cervical spine x-rays, abdominal ultrasound, or pulmonary function studies.
I apologize. It looks like I missed adding this question into the Zoom. That's my bad, y'all. All right.
Yeah, I know. I don't have it here in my notes at all as a slide, but that's fine. This is a great question, and we need to talk about this. I think this may come up later anyway, but we'll talk about it now. let's see what you guys do with it.
Oh, there's no polling then for it, Devin. Is that
Oh,
right?
I see. Okay, all right. So let's just talk about bleomycin then. Okay, so bleomycin is one of those drugs that can really cause pulmonary toxicity. Okay, and so if you can hook up bleomycin and pulmonary toxicity, that will always get you to the correct answer. So based on that, option 4 would be the correct answer, because the physician will do some studies before they start the client on bleomycin, and they will do respiratory studies, pulmonary function studies, to make sure the respiratory status is okay because of the concern of pulmonary toxicity. So just make a note, bleomycin, pulmonary, and that will help always get you to the correct answer. We may have something on that later on in the presentation also. Okay, next slide. Okay, so the nurse is teaching a group of high school males in a health class about how to perform a testicular self-exam. Which instruction should the nurse provide? Perform TSE at least every 3 months, examine the testicles while lying down, do the exam after a warm bath or shower, gently push on the testicle with 2 fingers to feel for a lump. Okay, so our answer here is option 3. Because after a warm bath or shower, the skin is most relaxed, and it's going to be easiest for that person to feel for any lumps. It doesn't matter what size that lump is, a little pea size, head of a pin size, it needs to be reported to the physician, because prognosis is great if it's early detection. And so that's really important about testicular cancer. 3 months, nobody selected that. Great, that has to be done every month. It needs to be done with the person standing, and I'll show you a picture real quick after this. And gently push. Gently is a good word, but we don't want to push with 2 fingers to feel for a lump. Okay, so let's take a look at the next. Okay, so here is a picture of testicular cancer. And again, what's really important is the tumor, and the size of it doesn't matter. It needs to be reported. You need to know that the signs and symptoms of testicular cancer, you could possibly be asked about that. It's usually asymptomatic and found on testicular self-examination. So that's what's really key about it. Okay, so make sure you go over those signs and symptoms, and they're all in the book. Okay, and then the next slide, I think, is a slide that shows how to perform the self-testicular examination. I'm not going to read this to you. This is actually in your book. Okay, and I think it's on page 539. But what you need to do with the testicular self-exam and the breast self-exam is you need to be able to teach a patient how to do this. So if you can stand there and talk to yourself about how you would teach a patient to do this exam or the breast exam, then you're going to be fine. And again, this is prevention and likely to be asked about testicular self-exam or breast self-exam. Okay. All righty, the nurse is instructing a group of high school females about breast self-examination. The nurse should teach the students to perform the exam at which time? At the onset of menstruation, every month during ovulation, 1 week after menstruation begins, or at the same time of day each week. So again, we're back to teaching here. Let's see what you do. Okay, so most of you selected option 3, which is definitely the correct answer. And the reason that that is the correct answer, one menstruation begins, is because the hormones are less active at that time. And, at the beginning of the menstruation or even during ovulation, there's a lot of hormone stimulation, and that can cause breasts to swell, and there will be a lot of lumps that might be felt that really aren't truly lumps, and they're more cystic sort of things. So 1 week after menstruation, when hormone stimulation is low, is the best time. Now, for the person who's postmenopausal, what you need to teach that person is to select a day, maybe their birthday. If their birthday is the 10th of the month, then on the 10th of every month, they should do a monthly self-breast exam. And that's how they can remember to do that. Okay, on the next slide, we show, I think, a picture here of where the location of breast tumors are. On the right, you see a picture of breast cancer. On the left, you see the breast and the tail of Spence, which is where most of the 48%, most of the tumors occur, and that's sort of up towards the armpit. Okay, just to keep that in mind. And then on the next slide, we have a picture of very late cancer. We don't ever want it to progress to this point. It's called pude orange skin and the tumor. And a lot of times we have broken skin and drainage, and that is a very late sign of cancer. And then on our next slide, here we are, the stages of breast self-examination. And again, I don't need to go through all these. It's in your book, and there's in your comp review book, entire description of what to do and all of the steps to take. And so read that and make sure that you'd be able to stand there and teach a patient how to do it. Okay, and that's what you would need to know for that. Okay, let's see what we have next. Okay, we have a question on external radiation. Okay, a client receiving external radiation therapy to the left chest has been given information about skin care. The nurse concludes the client understood the instructions if the client made which statement. I will handle the area gently. I will use deodorant every day. I will wear snug fitting clothes. I will enjoy as much sunshine as I can.
My goodness, don't think I have this one as either.
I know, I don't have this in my notes either, so.
I apologize again.
No, that's okay. That's all right. We'll go over it. I think we're going to talk about external radiation again later, but we can go over this question now. I don't even have this in my notes, but let's look at this and I'll tell you what the answer is. Okay, whenever a person has external radiation therapy to the skin, we're concerned about skin integrity. And this is internal, both internal and external radiation are in your chapter, oncology chapter in the comp review book. And I would recommend looking at client teaching points for external radiation therapy and nursing care points for a person with an internal radiation device, okay? So your answer to this question is option 1, okay? I will handle the area gently because again, we're concerned about skin integrity. They would not use deodorant. They would not put any creams or any lotions or anything in that area near the skin that's being radiated. And this person is getting radiation therapy to the left chest. So we'd be worried about that axilla area. No snug fitting clothes, again, skin integrity. So loose clothing and sun. Radiation is like burning the skin. So you definitely would want to tell that person to avoid any sun on that area. Okay, so hopefully that helps. And if you have any questions about that, let me know. Okay, let's see the next one. Okay, so here is one on internal. Is this one? Do you have this one?
I do not.
Okay, all right. So good thing I know the answers to these questions, huh? The nurse answers the call light of a client who had insertion of an internal cervical radiation implant. The client says the implant fell out, and after moving the sheet, the nurse sees it lying on the bed. Which action should the nurse take first? Call the radiation safety department, reinsert the implant into the vagina, pick up the implant with gloved hands and place it in sterile saline, use long-handled forceps to place the implant in a lead container. Okay, so I just wanted you to have a chance to think about that and what action should the nurse take first. So if you ever saw an implant in the bed of a patient who had an internal cervical radiation device, you would never touch it. There should always be a lead container in the room of a person who has a radiation implant. You would use the long handle forceps that come with the lead container, pick it up with the forceps and put it in the container. Okay, then you would call radiation safety department. You would never reinsert anything into the vagina, or reinserting things into a person is really not a good choice for anything. And you would not want to pick it up with gloved hands. Remember, it's radiation. Okay, and there are a lot of guidelines for a nurse who's taking care of a person with a radiation device, an internal device. They're all listed in your comp review book. So make sure you read that. They need to be in a private room. You need to wear a dosimeter badge. You need to wear a lead apron when you're in the room taking care of the patient. You don't want to stand in direct radiation pathway. So if a person had a cervical radiation implant, you wouldn't want to stand at the end of the bed and talk to the patient. You maybe want to stand near their shoulder and talk to them. So there's pregnant people should not be going into the room. Children under, I think it's 13 years. Take a look at that information in the book and it'll give you all the guidelines. That is something that they may ask you about because of the safety issues that we're concerned about. Okay, let's see what we got next, Devin. Okay. A client receiving chemotherapy is experiencing neutropenia. Do you have this one?
I do. It looks like some of the questions are out of order, not with the PowerPoint.
Okay.
I do have this question.
Okay. The nurse should take which action to protect the client until the results of laboratory studies improve? So this person has neutropenia. Restrict all visitors, limit fluid intake to 1,500 mLs daily, insert a urinary catheter to minimize infection, restrict fresh fruits and vegetables in the diet. Okay, so we don't have anyone who selected 2 and 3, which is great. The answer here is 4, however, and let's just take a quick look at that. Restricting all visitors. Restricting all visitors is not necessary. We would definitely restrict visitors who have colds or are sick or whatever, but a person who's neutropenia, we would allow visitors to go in the room if they're not sick, and they would have to, gown and wear masks and gloves, etc. But the word all should steer you away from that option. You're great with option 2 and 3, limiting fluid intake, not a good choice. I mean, unless the person has some renal disorder, but this is not a good choice, especially for a cancer patient. And inserting a urinary catheter to minimize infection, well, insertion of a urinary catheter can cause infection, and no one selected that, so that's great. Now, why is option 4 correct? The person has neutropenia, which means that they're at very high risk for infection. So we need to do everything we can to protect them. Fresh fruits and fresh vegetables and flowers too is another thing we want to keep out of that person's room, because they harbor bacteria. They can, especially plants, can harbor Pseudomonas. And so we don't want to expose people to that. So fresh fruits and fresh vegetables should stay out of the person's room. If we're going to give them fresh vegetables, they need to be really cooked thoroughly, okay? And so that is why, option 4 is correct. Okay, next question. Let's see what we have next. Okay, so we have a question on stomatitis, which I think is out of order also, but we will try this one. A client is experiencing stomatitis as a result of chemotherapy. The nurse should encourage the client to increase intake of which best foods? Ice cream, fresh grapefruit, hot soups and broths, scrambled or poached eggs. Okay, so some people said ice cream, but the answer here is option 4. And let's just take a look at this. So we want to give that person soft foods that are cool or warm to touch rather than hot or very cold or spicy foods. So first of all, ice cream is cold. That's going to cause a problem. That's going to make them more uncomfortable. Plus, ice cream kind of can coat the mouth. So we don't want that to happen with a person who has stomatitis. Now, fresh grapefruit, 3% of you selected that, but that is acidic, and that is really going to cause some discomfort and pain. And the word hot in option 3 is not good. So hot soups and broths is not a good option. And so we're down by the process of elimination to option 4, scrambled or poached eggs. So that is, from the options that they're giving you, the best answer here. So ice cream, too cold. Grapefruit is acidic. For patients with, if we don't want hot soups and broths, patients with stomatitis always inspect their mouth, check their mouth before and after meals. There are topical anesthetics that we can give to that patient to use to coat their mouth, but you definitely want to avoid alcohol or any glycerin-based mouthwashes or swabs, okay, for a person with this disorder. And that can occur as a result of chemo from breakdown of cells. Okay, next question. Let's see what we have next here. Okay. I mentioned multiple myeloma before, and see what you can do with this question. The nurse has just received internship report for a client with multiple myeloma. After reviewing the client's care plan, the nurse would place highest priority on which intervention: encouraging fluids, coughing and deep breathing, providing frequent mouth care, and monitoring the BUN and creatinine levels. Okay, so we're kind of all over on this. And it goes back to that concept that we talked about first off this morning about hooking something up to something specific. Now, remember we said this morning that multiple myeloma is like a malignant proliferation of the plasma cells in the bone. And one of the biggest things that we are concerned about with multiple myeloma, and this needs to jump in your head, you see a question on this, is the risk for pathological fractures. They need to drink at least 2 liters of fluid a day to offset any potential problems associated with hyperuricemia, hypercalcemia, any proteinuria that happens because of that proliferation of plasma cells in the bone. So your answer here is option 1. Coughing and deep breathing, I can understand why you went there. And you think of airway, breathing, and circulation, and you see the words highest priority in the question. I can understand why you went there with that answer. But again, you've got a multiple myeloma. Think about the bone and the fluids. Providing frequent mouth care, that is for any client with cancer, any client even without cancer. Mouth care is important. And monitoring the BUN and creatinine levels, that is a really important intervention for multiple myeloma because it can affect, multiple myeloma can affect the kidneys, but for highest priority is the pathological fractures that we're concerned about and encouraging fluids. So fluids is your answer here, okay? Okay, what do we have next? Okay. A nurse caring for a client who underwent partial gastrectomy earlier in the day notes the client's nasogastric tube is draining scant amounts of bloody drainage. Which action should the nurse take? Irrigate the NG tube, reposition the NG tube, continue to monitor drainage, look for other signs of hypovolemic shock. Okay, option 3 is your correct answer. This one's kind of out of order from what I had looked at previously from these slides. But I can tell you that option 3 is the correct answer here. We're only seeing a scant amount of bloody drainage. So scant amount is expected, okay? So there are no signs of hypovolemic shock, and I'm glad no one selected that answer. Irrigating the tube, it's not the best choice. First of all, there's only scant amount of bloody drainage, and there's no indication that that tube needs to be irrigated. So you wouldn't want to do that. Plus, for anyone who underwent a gastrectomy, you really need a physician's order to irrigate that tube. You can't just go irrigating on your own, because when the person has a gastrectomy, an NG tube is inserted, and the person will come back from surgery with that NG tube, but it's strategically placed in the stomach, and it's placed near the sutures in the stomach. And so you go irrigating that, you could affect that suture line. And that is the same reason why we would not reposition the tube, okay? Because it is strategically placed by the surgeon, and we don't want to disrupt that suture line inside the stomach. So continuing to monitor the drainage is definitely the correct answer. Okay, let's see what the next slide shows. All right, a client with laryngeal cancer underwent radical neck dissection and tracheostomy. The nurse provides instructions to the client about stoma care. The nurse determines that the client needs additional instructions if the client makes which statement. 1, I need to keep powders and sprays away from the stoma site. 2, I need to use a dehumidifier year-round to keep the air as dry as possible. 3, I need to protect the stoma from water droplets, such as in showers and pools. And 4, I need to apply a thin layer of Vaseline around the stoma to prevent skin cracking. Okay, option 2 is the correct answer based on the way this question is worded, that the client needs additional instructions, and that would be option 2. No one selected option 1, which is great. But we want a humidifier, not a dehumidifier, because the dehumidifier is going to dry the air too much, and secretions are going to be dry and very difficult for that person to expectorate, and they're going to end up with an airway problem. And so option 2 is the correct answer here. They do need to protect that stoma from water droplets, and they can apply a thin layer of Vaseline around the stoma to prevent any breakdown or whatever. Okay. Let's see what the next question is. Okay, so here is a laryngoscopy where they're looking into the larynx. And here is a picture on the right of laryngeal cancer, what they would see if that person had cancer. So just a picture of what it would look like to help you there. And we'll see what's next. Okay, a client has just undergone radical mastectomy. The nurse should plan which action to prevent edema from developing on the operative side. Place cool compresses on the affected arm. Elevate the affected arm on a pillow above heart level. Avoid arm exercises in the immediate post-operative period. Maintain an IV site below the antecubital area on the affected side. Okay, option 2 is the correct answer here. Remember, read your question carefully. We want to prevent edema and think about the principles of gravity. You wouldn't place cool compresses on that affected arm because that could affect circulation, which we want to ensure is maintained because there will be swelling. So elevating that affected arm will help. Avoid arm exercises in the immediate post-operative period. We don't want them to do active arm exercises, but we do not avoid them. What we would have that person do is twist the wrists, bend the elbow, bend the wrists and the hands back and forth. No range of motion exercises, of course, but we do want them to do a few twisting kind of motions with their arms and hands. And generally, mastectomy patients, we would not insert any IVs or take any blood pressures on the side of the mastectomy because we're really concerned about lymphedema and the drainage of the fluid from that arm, which could be a real problem with people who have mastectomies. Okay. On this next slide, these are some of the post-mastectomy exercises that usually the healthcare provider will prescribe it. These are not exercises you would do in the immediate post-operative period. Once healing has occurred enough and the person has these hemovac drainage devices removed, that's when these post-mastectomy exercises would be prescribed. Because most patients after mastectomy will have 1 to 2 little hemovac kinds of drainage devices to drain the blood that is underneath the tissues in that breast area. Okay. The nurse is caring for a client who has metastatic breast cancer. During care, the client reports a sudden, sharp pain in the back. The nurse should take which action? Encourage the client to sleep on the side, instruct the client to take more pain medication, notify the healthcare provider of this development, encourage ambulation to build lower back strength. Okay, definitely option 3. You did fantastic with this question. Sudden sharp back pain is breast cancer can metastasize to the bone. And so what we're really concerned about is a spinal cord compression. So option 3 is definitely the correct answer. You would not want to tell the client to take more pain med without a physician's prescription to do so, and sleeping on the side is not going to help. And your concept of metastatic breast cancer and knowing that it can metastasize to the bone, causing spinal cord compression, brought you to the correct answer. Normally, we do something before we contact that healthcare provider, but if you look at those options, they're not reasonable for the data they're providing you in the questions. So you did excellent with that. Great work. Okay, let's see how much more we have here.
Devin, can you give us an idea of how much we have left? Are you able to
That was the last
tell?
question, Dr. Silvestris.
Oh, okay, that was the
Oh,
last
great.
question.
Awesome.
All right, so let's see if any of the students have any questions.
I did have a question, but it was like in the very beginning about the impetigo question.
Yeah,
So it said a need for further teaching, and the answer was the child should take an antibiotic. But I thought for impetigo, the treatment for it is an oral or topical antibiotic.
the treatment would be, great question, and the treatment would be a topical antibiotic. It would not be an oral antibiotic, okay? So the child wouldn't take an antibiotic, but topical would likely be prescribed. Does that clarify it?
Was
Yeah.
it maybe the wording of the question, Devin? Could we just take a quick peek at that question? Because it might be the need for further teaching that is.
I thought it was, you know, a question that was difficult. But it said, I think it's right here, the child will need to take an antibiotic. And that's why
Mhm.
That's the answer, because they don't take oral antibiotics.
Mhm.
What's used for treatment is topical. Unless some secondary infection that systemically is affecting the child, then perhaps an oral antibiotic might be prescribed.
Mhm.
Yeah,
That's good. That is a really hard question. And then
it is a hard question.
Nick's comment, if it said apply an antibiotic, would that then still determine a need for further teaching, or would that be an okay response?
That would be an okay response. We would probably need to add oral in there, and that might help, but that would make it really easy, but we could add oral in there.
Yeah, that's what
might
I'll
wanna
do.
do
I'll
that,
make
Angela.
that change. Yep,
Yeah,
I'll
you
make
might
that
wanna-
change right now.
Yeah.
But I think that's a really good differentiation, you guys, and you're really looking closely at these questions, which is exactly what we want you to do.
Yeah,
So this
we
is
definitely want you
this
to
is
do
good.
that. But the child would not take an antibiotic. But it would be an application. But that would, if you add oral in there, that still makes option 2 the answer to this question as it is stated. Further teaching is needed. So that works. That makes it kind of a little easier, but that's okay. It clarifies it.
Yeah,
So
I
that's
think
good.
it still tests the concept of the oral
Yes.
antibiotic, which is just good. And so just be on the lookout, you guys. Be really careful with the need for further teaching questions,
Yeah,
because
yeah.
those make you twist your brain to answer them correctly. So
Yeah, well, you guys did great. And that's a great question. Thank you for bringing it up. And thank you, Nick, for your input.
are there any other questions? Thank you so much, Linda,
Oh,
for
you're welcome.
this presentation. It's fantastic. And just when Devin was going back through those slides, it's like, wow, we've covered a lot. And so you guys are off to a really good start this morning. I know it was a long, just about 2 hours now. So you did great. We'll give you a break now before Miss Lisa is on. And if you think of any questions over the break, just let us know. Thanks again, Linda. Really, really
Oh,
appreciate
you're
it.
welcome. I think I come back after Lisa.
Yep, you'll be back after Lisa if that's still okay with you.
Of course it is.
So
Yes.
we'll see you then. You're welcome to stay on and listen if you would like.
All right,
All
thank
right,
you.
guys. Oh, really quick. Hey, guys, really quick. I noticed some people were going into the neuromuscular link. Can we instead please go into the cardiovascular? And Devin, I'm not sure, is it possible to post the link in the chat before they leave?
The respiratory and cardiac section for Lisa.
Yes,
Okay.
thank you.
Yeah, I think that's it. I'll pop over there when I stop recording to make sure it's working.
Okay, thank you, everybody. See you in the next section.